tests are used for thyroid diagnosis. A thyroid ultrasound of the neck can be used to gain information about a thyroid nodule without exposing it to any radiation. USG results suggest the nodule is cancerous, include a dark appearance, small calcium deposits, more blood vessels than normal, irregular borders, etc. To confirm the diagnosis of a thyroid cancer, a thyroid biopsy is used. What is a thyroid biopsy? A thyroid biopsy involves collecting a sample of cells so that they can be looked under a microscope for signs of cancers. A small thin needle placed with thyroid nodule can draw up the needed cells. This is called fine needle aspiration and can usually be done in typical exam room with local anesthesia. An ultrasound may be used to help the guide needle into the nodule. The FNA may give 4 results. Non-diagnostic. This means that not enough cells were removed to make a diagnosis. Even in the best of hands, this happens 5 to 10% of the time. Typically, the FNA will be repeated. Benign thyroid nodule. This means that there is 97% chance that a thyroid nodule is not a cancer. In most cases, patients with a benign biopsy are watched with an ultrasound and physical exam 6 months later and regularly scheduled times. Malignant thyroid nodule. This means that there is a 97% chance that the thyroid nodule is a cancer. Sometimes the results say that thyroid nodule is suspicious for thyroid cancer, which means there is 80 to 90% chance of cancer. What if the thyroid biopsy does not give a clear diagnosis? If there is still uncertainty after the biopsy, the next step may be surgery to better access to the thyroid and remove a larger section. Surgery is often necessary to diagnose follicular thyroid cancer and Hurthle cell carcinoma. Are there any tests done after diagnosis is made? After diagnosis of thyroid cancer has been made, CT scan may be used to see if disease has spread to other parts of the body, particularly in case of aplastic neothyroid cancer. If diagnosis of thyroid lymphoma is made, a total body PET scan may be done to look for lymphoma elsewhere in the body in order to stage the patient. What are the stages of thyroid cancer? Thyroid cancer can be grouped into different stages based on their size, spread, and the involvement of nearby lymph nodes. These stages can help determine patient options and likely outcome. Many cancers are staged using the TNM system. T stands for the size of the tumor, N describes the lymph node spread, and M describes any spread to other organs called metastasis. Each of the TNM variables can be further broken down like this. Tumor size: T1 less than 2 cm, T2 2 to 4 cm, T3 4 cm, T4 tumor growth outside of the thyroid, T4A grows into nearby structures, T4B grows in spine or nearby large blood vessels. N lymph nodes. NX regional lymph nodes can't be assessed. NO no involved regional lymph nodes. N1 involved regional lymph nodes. N1A involved central lymph nodes. N1B involved lateral neck or mediastinal lymph nodes. M metastasis. M0 no distant metastasis. M1 distant metastasis. Based on these categories, the cancer is assigned a stage of 1, 2, 3 or 4. Stage 1 is the least advanced form of cancer and stage 4 is the most advanced. All anaplastic thyroid cancer are considered stage 4.